Hello, mamas to be. Let's talk about the not so glamorous aspects of pregnancy. From nausea to fatigue, I've got you covered on the minor discomfort of pregnancy. So, in this video, I'll share with you what nausea and vomiting in pregnancy is and then ways to manage it. So, to commence with, minor discomforts are temporary and manageable symptoms that pregnant women experience during pregnancy. This is the time when the body is just starting to adjust to the pregnancy and then hormones are still in chaos. So, with the nausea and vomiting, these are the earliest symptoms of pregnancy. It begins in the weeks of 4 to 8 and then lasts within the 16 to 20 weeks. But however, some women may experience it throughout the pregnancy. The physiology of nausea and vomiting is due to hormonal effects of both human chorionic gonadotropin and estrogen on the smooth muscles of the upper part of the gastrointestinal tract. Let me break it down. So HCG, that is human chorionic gonadotropin, is a hormone that is produced by the placenta to support embryonic growth, and then estrogen is also a hormone that is produced by the ovaries, which supports placental function and development during pregnancy. So the increased levels of both HCG and estrogen affect the upper part of the gastrointestinal tract. That is the mouth, the esophagus, and the stomach, which leads to the relaxation of the smooth muscle, and as well increase sensitivity to taste and then smell. So how can we manage nausea and vomiting or morning sickness? So we have to eat smaller but more frequent meals. That is, we have to eat in bits. The second one is that we have to avoid overeating and then eating of fatty, fried, and spicy foods such as creamy sauces and then fried foods, etc. In addition, we have to avoid lying down immediately after eating, but sit upright for at least an hour after a meal. Why? Because lying down immediately after meals or after eating can cause the stomach to take longer than usual to empty its contents, so the small intestines, leading to not just nausea and vomiting but bloating and discomfort. We can also take in dry biscuits such as crackers and then dry bread. Aside from that, we have to also avoid brushing our teeth immediately after taking in meals. Why? Because brushing your teeth after meals involve you bending and then leaning, which can put pressure on the stomach that will cause you to vomit. Aside from that, we have to also avoid others or other known factors that are likely to induce vomiting. We can also use a homemade remedy, that is ginger. So ginger is an anti-inflammatory property that is traditionally used to alleviate nausea and vomiting. So you can make a ginger tea by adding a squeezed ginger with warm water. Then you are good to go. But there are instances where pregnant women experience excessive vomiting, which can lead to a condition known as hyperemesis gravidarum. So this condition requires immediate medical attention. So if you're a pregnant woman and you are experiencing nausea and vomiting that worsen over time, it is essential to report to your healthcare facility for proper evaluation and care. Thank you for sticking and staying with me. If you found this video helpful, consider following my page for more videos and updates. In our next voiceover video, we will explore the physiology of heartburns in pregnancy.